unopened, and unexpired. Just as a little helpful hint, on your kits, if you want to highlight the material that your catheter is made of, to remind you, you need to ask the latex question and highlight, which mine's not, the povidone iodine, to remind you that you need to ask if they're allergic to betadine or iodine or shellfish. And then your expiration date on this one, it's going to be down here on the bottom on this piece of paper to remind you to say it's intact, unopened, and unexpired. So that's just there. So I've gathered everything. Everything's intact, unexpired, unopened. In addition to my Foley Catheter kit, I need the sterile gloves. I need my clean gloves and my pericare supplies, and I'm going to need a roll of tape to secure it to the leg, which we have some extra up front if needed. So I got my order, I got my supplies, I'd come into the room, I'd identify my patient with double identifiers. I'm going to do my level of consciousness, ask them their allergies, palpate their bladder, do an assessment, and they are distended, and then we will start. So I'm going to roll my covers up from the bottom, get my pericare supplies, position my patient, put on my clean gloves, and so pericare is the same as it was before we did our in and out cath. Nothing has changed there. I have a basin of warm, clean water, rags and soap, and a towel. So I have a male patient here, so I'm going to get my one rag, wet it with clean water, put my cleansing foam or soap on it, and clean around the head of the penis with one area of my rag, change that, go behind the head of the penis, change that, and go at the base and around the scrotum. Get rid of my soapy rag, get another rag, which is just with clean water. I'm retracting the foreskin if it's an uncircumcised male. I'm going to leave it retracted during this process, and now I am rinsing with clean water. And then we're going to pat dry. Rolling good. Take off my gloves, wash my hands, and get what I need. So I have my Foley tray. It's intact, unopened, unexpired. I'm going to use the outer wrapper as my trash receptacle. If you are so inclined to sort of prop it up like a little trash can, you can, but I'm not very good at that, so I'm just going to sit it down there and put my trash on top of it. This kit is wrapped just like our other kit. We want to position it on the bed between our trash and our patient, and we want to orientate it so we're going to open it away from us first. Yours will be a little tape on there when you first open it. So we pull it away, and we're going to do the sides. And we're going to go towards this. Then, just like always, there's a nice drape on top. It has a shiny side and an unshiny side, and mine is dog-eared back. So I'm going to pick it up by that dog ear and unfold it. Drape it. So if my drape hits my box, that's okay, because I didn't touch that side and it was still sterile, and everything down there was sterile, so it's okay if it touches, if it overlaps either one of your kits, and then when you get your gloves on, you can reposition things, so that's fine. And it fell. Okay, drapes are just like cuffs on our gloves. If you absolutely cannot live with how it has fallen, you can start over, but otherwise just drop it and bring your hands away, and hopefully you can just deal with it. It's just sort of an extra bonus to extend our sterile field. So I'm going to put on my sterile gloves. I have them on my table over here towards the head of the bed, so I can keep my sterile field in my line of vision. First one up by the cup, hold my hands up nice and high. Two sterile hands. So now I'm going to manipulate and set up my tray. I have that fenestrated drape. I'm not going to use it, so I'm just going to put it in my trash. I have a pair of gloves. I'm not going to use those. I'm going to use these gloves. I'm going to put that in my trash. And now I'm going to show you what's in here. I'm going to hold it up for you. So there's this little tray on top of a bigger cardboard tray, and on here we have lubricant, have our povidone iodine solution. We have our forceps and our cotton balls. We have a syringe that has sterile water in it. We have a little container for a specimen and a label. We don't need to get a specimen with this, so I'm not even going to bother that. Put this stuff back on there. And this bottom box has your catheter with your drainage tubing and your drainage bag all coiled and secured in there. When you open yours for the first time, you will notice on your catheter there is a piece of blue plastic, and that is going to be on there every time you open a new kit. We're going to initially take that off, but then after we use this and we put lube on it and we clean it, it's hard, almost impossible to get that plastic back on. So that is something you will take off and throw away. You won't repackage it with that. But remember, when you open a new one in practice, it's going to have that blue on there. And you still need to get it off of there and keep this sterile. So the first time, and in practice, you're going to rip it from one end and you're going to take it off, and you're keeping control of your catheter as you do it over your box and lay it back down. Yesterday I saw people that go and just pull it off, and this goes whipping around because we're not going to use it in lab, but you still need to keep this sterile, and you will have to take that plastic off. So just pick up your catheter, rip it, and sort of control your catheter in your hands. You got two sterile hands, however, to get that off of there, and lay your catheter back in your box. So everything's back the way it was. So I opened this, put my gloves in my drape I'm not going to use in my trash. So now I'm going to set up my tray. Two sterile hands. I'm going to pick up my lube and my iodine. So move my forceps over. I'm going to open this, pour it over top of my cotton balls, bring it out, put it in the trash. Put my forceps back on top of there. My lube, again, you still have options on different ways to do your lube. I just choose to plop it right here on top of my tray as I'm setting it up and put it in the trash. I'm not going to get a specimen, so I'm not even going to worry about that specimen cup. I'm going to leave it. And now I need to attach this to my catheter while I have two hands to do so, because it is possible, but it's very difficult to attach it with one hand. Once I contaminate this hand, I need to keep it sterile. So I'm going to attach that now. So I'm going to pick up my top tray and move it in front of my box. This has a little cap on it. I'll take off, I'm going to throw it in there so I don't lose it. And then I'm going to pick up my catheter and attach my syringe to the port of the lumen that inflates my balloon. I'm going to lay that there, back in my box. So everything is set up for what I need. So I got everything set up. Now I'm going to contaminate this hand. So I have a male patient, so I'm going to grasp the penis, hold it at a 90-degree angle, and I need to clean. So once I hold, I freeze my hand. I'm not going to move it anymore. So I'm going to get a cotton ball, clean around the meatus, one swipe, take it out of my field, throw it away. Get a second one, go right behind the meatus, take it out, throw it away. And I know that I'm getting betadine all over my hand, but that doesn't bother me. Going right behind, up against my hand, and throwing it away. I don't need my forceps anymore. I'm going to throw them away. I'm not going to put urine in this tray, so I'm just going to leave the cotton balls I'm not going to use. I'm not going to fuss with them. So I've cleaned, and now I'm going to pull up my catheter, dip it in my lube, and then I'm going to pull this box up over that ridge so it's closer to what I need. So when I pull on this, I have to move that syringe. I'm not going to have to fight with it too much. So it's lubed, it's cleaned, and here we go. Take a deep breath. Insert. Spreading it from a distance. Remember, for a male, said we need to go 7 to 9 inches before we get urine. So I may have got urine by now, but just to make sure I'm out of the urethra, for the male, I'm going to go that extra distance and go all the way to the Y bifurcation to anchor this fully. So I'm all the way as far as I want to go. So now I'm going to take that non-dominant hand and I'm going to grasp that catheter right there to keep it from moving anymore. I'm going to take this hand and I'm going to inflate my balloon. There is pressure on this syringe, so you need to put some force behind it, and you need to go all the way. It was a 10 ml balloon. I have 10 ml in the syringe, and I inflated my balloon. If I let go of that plunger, see what happens? Because there's pressure in there, so it unfills itself. So So you need to put all the fluid in, and you need to keep pressure on the syringe. So now my balloon's inflated. I need to take the syringe off of there, but I'm done with placement. So what I'm going to do is just one whole movement. I'm going to pull this down towards the foot of the bed till it's anchored and sterility is over. I can sigh relief. And I can use both hands and take this off and get rid of it. Some people will try to take the syringe off here, but it's a little bit difficult, and then you want to make sure you don't move that catheter in anymore. So it's just, I think it's easier to bring it all the way down, take it off, and you're good. So this is covered with betadine and lubricant. These are covered with betadine and lubricant. So I need to clean everything up. So what I'm going to do first is just take my catheter out of the box and sit it on the bed. So that gives it slack there, so he's going to be okay. All of my trash, I'm going to clean up and throw away. I'm just going to stick it in the bed. These are all slimy in betadine. I'm going to take those off, throw them away. I'm going to clean my hands, get a new pair of gloves, get my peri-care items, and get a roll of tape. So I have everything here that I need. I'll wash my hands, put on my clean gloves. So now I want to get all that betadine and lubricant off of my patient and my catheter, because it could be irritating and it's also slimy. So I have my basin of nice warm water. I have my soap for my phone. I'm going to put it on here. Now, remember before I said if you did in detail or demonstrated at the beginning, you could say I would do it the same as I would in the beginning, right? So I can say that I would do it the same as I would in the beginning, but what has been added that wasn't there in the beginning? Catheter. So if I do it just the way I did in the beginning, I will neglect to clean the catheter. So in addition to doing it the way I would in the beginning, I would take a fourth area on my rag, and I'm going to clean the catheter away from my patient with my soapy water. And then I'm going to take another area of my rag after I rinse, and I'm going to rinse the catheter away from my patient with just water, and then I'm going to pat dry everything, okay? It's a male patient, so I need to say I would put the foreskin back to its natural position. So he's clean, and his foreskin has been returned. So now I want to secure it to his leg, because remember we want to keep slack in there so it doesn't pull on his urethra and cause any trauma. So I'm going to put his legs back, and then I need my tape. For a male, we're going to tape to the top of the leg. A female, we tape to the inner leg. Like I said, some males you might see up on the abdomen. I'm going to use 2 pieces of tape. I'm going to take one piece of tape and put it on his leg to sort of act as my skin protector, or so I'm going to tape the tape to that piece of tape, and hopefully if it comes loose and I need to change it, I'll only need to change my top piece of tape. This is my hope. Take my second tape, put my catheter on his leg, and I'm going to tape it right at that Y. Take this side of the Y or that side of the Y. But we're taping at the Y, so if that pulls, it catches right there at the Y bifurcation, so it doesn't hopefully pull it out of the urethra. Got nice slack there, so now that's safe. So now I need to take my bag and hang it. Where do I want to make sure my bag stays? Below the bladder. Below the bladder. There's these little clips you'll find on the tubing, and that's just another little tension reliever. You can attach it to your bed linens, but they're not the best. I mean, they move, it clips right off. It's not very secure, but that's what it's for. You'll see them, they're white, they're green. And then I take my bag, and remember when we did restraints, there's all kinds of hooks on the side of the bed. We're going to hang our bag on a hook. My bag came off my hook. My hook. And then I'm going to cover him. Make sure my trash is away. Put his bed down, put his rail up, make sure he has everything he needs, take off my gloves, wash my hands, and then I would document. So like I said, there's going to be documentation for this competency. Just make your best effort, keep in your mind my date and my time, what I saw, what I did, how my patient reacted, and signature and credentials. So possible